Great. Thank you so much, Carl. And thanks to Samantha for that really well done overview, and to CSG for convening all of us, and for all of you and all of the really critical work you're doing. I hope you leave this entire discussion informed, but also really energized, and that you feel very appreciated. Because I think all three of us on this panel are huge fans of state policymakers, and understand how critical the work is that you've all been doing in 2020 and will be continuing to do in 2021. So let's start with the next slide. So I just want to put underline a point that Samantha made at the beginning of her presentation, and that is that the issue of inequities is a longstanding feature of our healthcare system. COVID indeed exposed the cracks that have existed for generations. You also see here it eroded a lot of the progress that we are starting to make in the last decade on closing that gap. Next slide. And while we focus a lot on health outcomes because we're all health policy wonks and that's what we care about at the end of the day, we also know that there is a really big correlation to economic equity, financial stability, and we really need to be considering that as well. Again, COVID really exploited these trends that we see here in this baseline, and we know from additional Commonwealth Fund research that the communities of color that we're talking about predominantly today were most impacted financially from the COVID crisis. There also is a correlation with adverse mental health outcomes. So really a plea and a reminder for us to be looking and thinking about not just health outcomes, but also the social, economic equity indicators as well. Next slide. This is an illustration of the point that I just made. You can see here the dark blue shows you that populations who have difficulty or have reported that cost was a barrier to accessing care. So darker is actually worse in this. Samantha referenced the impact of state policy decisions. You clearly see that here. We see more cost-related barriers to accessing care in the states that haven't expanded Medicaid. But I think what's really interesting in the maps that show the Black and Latinx populations as well, it's kind of regardless, despite state policy decisions, these are even in states who have expanded Medicaid and taken steps, we still see a persistent discrepancy across these communities based on their ability to access care due to cost. Next slide. Some of the new research that we've been looking at around how do we learn from what we know about these longstanding inequities, and how do we address them as we're rolling out this active push to get to the next mile on vaccinations that I know you are all focused on right now. You can see right here in this slide, this is new research from our partners at the African American Research Collaborative, that we see a tremendous amount of variation based on race and ethnicity around how much they've faced discrimination in the healthcare system. So this is just to the point that this is a long-standing issue. Unless we really address this, listen to what we're hearing from patients around what's going to make them feel comfortable, we're going to have a really difficult time reaching the very people that we want to reach with the vaccine, but also with other healthcare services. We're really thinking about COVID-19 as a bit of a microcosm for the entirety of our healthcare system, and this vaccination push is really emblematic of what it takes to kind of engage all communities in the healthcare system. Next slide. One thing that we didn't see a lot of variation in by race was the push and the deep-seated desire to get back. If they're going to get vaccinated, they want to do it with their own doctor. They want to do it with someone that's trusted in their community. And this is this was only asked of unvaccinated respondents. But we found that this finding held true when you controlled for political party, age, race, gender, disability status, urban, rural, it doesn't matter. All respondents, you can see here, across all respondents, there was a tremendous desire for folks to be able to go to their physician's office to be vaccinated. And so this is something, again, these results just came out last week. This is something that we're addressing in a number of projects at the fund to really help states think through how they can wrap around their healthcare delivery system, their safety net system, their primary care system specifically, to really incorporate the vaccine as one of the menu of offerings that they can provide to their community. Next slide. As we turn to the national policy landscape, I did want to share this set of findings that show that this is only among folks who have been vaccinated. It does appear that the election of President Biden was a fairly significant development that informed their decision-making around getting the vaccine. More than 30% of Latino respondents and just under 30% of Black respondents indicated that President Biden winning the election was a factor that increased their desire to get vaccinated. So obviously, federal policy matters, state policy matters. This is one data point, but I think a really interesting one that we'll have to continue to see how this develops and see what we can potentially take away from that. Next slide. This is my final slide on the African American Research Collaborative data, but we definitely don't know kind of what's in our future in terms of booster shots or how we're going to be addressing COVID and the ongoing vaccinations in the future. What we do seem to think, all indications are that it's going to be with us for a while. And so this question was really around if the recommendation was to take an annual booster for COVID-19, would you definitely do that? And you can see the discrepancies here. And again, it just reinforces that we've got a long way to go to listen to these communities about what their hesitations are. I think we've come a long way. We started talking about hesitancy, which made it sound like a personal preference, or they're just, they've got some concerns. We're really starting to talk more about vaccine confidence, because what we find is when we really get into some of the hesitancy findings, we're really identifying that there are access issues, there are discrimination issues, there are cost issues, right? Even if they don't have to pay out of pocket to get a vaccine, that messaging hasn't been, kind of well absorbed in every community. And so again, just a reminder that we really need to listen hard to what these communities are telling us are barriers. And frankly, if that can be something that we master coming out of COVID-19, I think our whole healthcare system is going to be a little bit better positioned to address some of these longstanding inequities that we've been talking about. Next slide. So this slide is really busy, but I wanted to give you a sense of how much this issue has been kind of thrust to the forefront in 2020 and into 2021. This is just a look at the Biden administration's kind of buckets of, we call them opportunity, it's a lot of activity, but the way we've been thinking about it is really, there are the specific COVID-19 kind of response areas. We can talk more about all of these, but I wanted to give you kind of a sense of just the breadth of where the activity is. So there's a tremendous amount of work that's been happening specifically with COVID-19 for a lot of the reasons that Samantha talked about. We know that the more likely you are to have a community that has a higher proportion of Black or Latino populations, you're going to have higher cases, higher hospitalizations, and higher death rates. There's a very real reason why COVID-19 and the equity component was a core feature of the Biden administration's plan. But beyond COVID, I think what we're seeing from the Biden administration, we saw hints of this in the campaign, is this concept of equity in all policies, this elevation of equity and the direction to federal agencies and offices to address and really come up with plans for how they're going to take on some of these trends that we've just been talking about. We can come back to this as well. Again, like Samantha said, 2020 really brought the social and economic justice issues to the forefront. There's a set of activities and actions in that bucket. Expanding access, we know that if you have coverage, you're more likely to have access to a usual source of care. You're less likely to have those financial barriers, the cost-related financial barriers that I mentioned before. And as Samantha showed in her slide, the folks that are falling in the Medicaid coverage gap are disproportionately people of color. So this is very much an equity conversation as well. The final bucket really is around maternal mortality. And this was really, I think, what got a lot of policymakers' attention in the equity space pre-COVID. And so there was, a lot of interest in this topic. States were doing, some interesting work. We were starting to realize how little we actually knew about maternal mortality and morbidity rates in the United States because of the way we collect data and the way we do not require standardization of data. And so this was really kind of a precursor, I would say, to kind of this broader equity approach. It is a lot of steps have been taken. It is definitely not fully addressed. And so a lot of work is still kind of focused there. So back on the COVID-19, the creation of the COVID Racial and Ethnic Disparities Task Force has been a really powerful kind of cross-cutting group to be able to identify everything from messaging around thinking about where these vaccination sources are going to be placed. You see the $25 billion around equitable vaccine distribution, but a really kind of pronounced understanding that the COVID-19 pandemic was disproportionately impactful across various communities. The executive order that basically said all federal agencies need to understand the equity impacts of their actions. So how they do their work and come up with a plan and assessment and report back to OMB. That's the first time we've really seen that level. Samantha mentioned the Office of Minority Health. Lots of steps were taken under the ACA. This is really saying, okay, this cannot just live in one office. Certainly resource the offices that are focused on this, but it really needs to be a cross-cutting effort. I think a couple months ago, we saw the CDC declaring systemic racism a public health threat. That was definitely a departure from what we had seen before. We know that the Center for Medicaid, Medicare Innovation, which is our agency that's really tasked with developing models and pilots and demonstrations for paying and delivering care in different ways, are really looking to include equity as an essential consideration in how they develop, test, and evaluate models, which again, this is a new development. We talked a little bit about the American Rescue Plan provisions. There's a lot of conversations in the ongoing work around infrastructure, around frontline workers, an investment in historically Black colleges and universities. I think we've seen, I'm a little bit surprised in terms of when I look at the campaign proposal versus what has actually happened in the social economic justice space. I think this is one area where folks are really hoping that the Biden administration continues to move forward. Obviously, they need participation from Congress, which we'll talk about in a minute. And obviously, the pandemic has been taking up everyone's time. But there's no question, it's one of the reasons that I showed you the economic inequities at the beginning, that we really have to talk about the social economic justice along with the health outcomes when we're talking about inequities. On maternal mortality, I'm going to skip to the next slide for Congress, and we'll talk about how that's been moving forward. One of the things that the American Rescue Plan did include was the allowance for states to use the state plan amendment to extend postpartum coverage in Medicaid to 12 months. This is one of those policies that people, Congress was trying, the House passed a number of bills. It just makes sense when we look at the data of when postpartum adverse events are happening. Many of them, the vast majority of them, are happening outside that 60-day window, and that 60-day window is where a lot of states are, terminating their Medicaid coverage. So ensuring that we've got kind of stable access to Medicaid coverage for birthing people 12 months postpartum is a really key provision to kind of keeping up that continuity of care. So the American Rescue Plan did allow states another vehicle in addition to the waiver vehicle, and there are some differences, and we can talk about that if folks are interested. The Senate Finance Committee, which has jurisdiction over Medicaid and Medicare, which is really important when we're talking about payment rates and incentives to kind of drive behavior change of providers, had been embarking on a bipartisan effort around maternal mortality. That is still underway. The House of Representatives has passed the Momnibus bill, which is a collection of, I believe, 20-some bills that are addressing everything from data collection improvement to mental health, which I know CSG has been really helping to lead the way on maternal mental health. So a really comprehensive set of bills coming out of the House of Representatives on maternal mortality and morbidity. Kind of pulling up from maternal mortality, on the Democratic side of the Finance Committee, Chairman Wyden had started this pre-election when he was the ranking member, and it has accelerated a little bit, but they are really focused on identifying all of the ways and all of the levers that the Finance Committee has. So again, they are, where Medicare and Medicaid is authorized, but they also have a tremendous amount of control over the tax system, employer-sponsored insurance. This is the committee that can really look at its levers and say, how can we look at all of the policy opportunities we have in front of us to address inequities? So they're taking that on right now. Again, this is not a bipartisan effort, but they are working on a package and are seeking to develop legislation later this fall. The Health Committee, the chair, Patty Murray, did release a comprehensive report. There's a link here in the slides for folks to address systemic racism, inequities in the health system, and really kind of flagged these same buckets, a lot of the same buckets that we've been talking about: immediate COVID relief, reducing bias in the system, improving access, and then making these large-scale investments in healthcare for communities of color. And then finally, there's been a lot more attention, and again, I think we have COVID to thank for this, to the direct care workforce. We know that this population is predominantly people of color, predominantly women, predominantly low income, really, really hard hit by the pandemic itself. I think never been more obvious how critical they are to the functioning of our healthcare system and the public health of our community. So we're seeing a lot more attention and discussion about what to do to support the direct care workforce. Next slide. So what does this mean for states and what's happening in states? I know Hammy is going to talk a lot about what some promising models are. But obviously a substantial amount of activity around ensuring equitable COVID-19 vaccination efforts. I think we are nothing short of just in awe of how fast state policymakers had to really make a plan. Not saying that missteps weren't made across the board everywhere. Federal guidance was changing daily, sometimes hourly. And states still had to figure out how to set the standards for who is to be vaccinated and develop the systems. And I can honestly say that like we are really worried that equity would be an afterthought. There were some places where it was not the leading consideration, but I think a lot of those areas really kind of recalibrated thanks to the work of Hammy, and a lot of her colleagues were able to learn from each other, partner with the private sector, really look to the federal government for support and additional resources. And I think we have a long way to go on ensuring equitable vaccination for sure, but we see a substantial amount of activity at the state level in this space. As I mentioned, maternal mortality and morbidity, we see a lot of states had already been thinking about ways to use waivers in addressing this population. And we see folks in states already kind of considering and getting ready to explore this. There's a lot of activity around looking at how we use Medicaid managed care contracts at the state level to advance equity. We've got a couple of projects in that space we can talk about if there's time. But I think really importantly, this broader consideration of equity impacts of proposed policy changes around coverage, payment, and delivery of care. I think this idea that we need to be thinking about equity and centering it rather than getting policies kind of out there and thinking about the equity impacts afterwards, where we've moved beyond that. Next slide. And so just in closing, before I turn it over to Hammy, I really do feel like we're in the middle of a historic policy window to address systemic racism. COVID provided a really harsh spotlight on how many people are faring in the United States. And it was a wake-up call for many and an opportunity to really address some of the longstanding inequities that we've been talking about. Still sustain momentum on efforts to address maternal mortality and morbidity. Equitable vaccination efforts, like the broader efforts to address health inequities, will really require acknowledging the deep-seated mistrust and distrust of the healthcare system and of the government by communities of color, and taking action to undo the harm. If we take anything away from this, it's that we really have to stop and listen to the communities rather than assigning them to hesitant or not hesitant, and really find out what's making it difficult for them to access this care. In a lot of cases, they want to access it, and there's a lot of barriers in their way. Policymakers at the state and the federal level can take historic steps to address healthcare inequities by also addressing the policies around coverage and affordability, like we talked about. Payment and delivery change makes a huge, have a huge opportunity to impact equity. Enhanced racial and ethnic data collection and reporting is a top priority. We see many agencies really getting into the work on this. Incorporating the social needs and the drivers of health into healthcare delivery, and really exploring the intersection of social and economic justice and health outcomes. Next slide. Finally, I just want to acknowledge a couple of folks. Dr. Lori Zefran is really the equity expert at the fund. She's an OBGYN. If you have maternal mortality questions or equity questions in general, she is a fountain of information and is a terrific resource. Arnav Shah is on our data tracking team and has really helped us with our work with the African American Research Collaborative and help us really quickly digest what we're learning from this really large poll. And then Jesse Baumgartner is on our healthcare coverage and access team and helped with a lot of the race and ethnicity data charts. Two other things I want to say really quickly before I turn it over to Hammy. There are two incredible resources that you can get to by clicking on these hyperlinks here. The first one is the America COVID vaccine poll. This is the African American Research Collaborative partnership that I've been mentioning. There's really great data interactives at this covidvaccinepoll.com address. And the other is, I think it slipped because I had so many names that I had to thank, but we'll put it in the chat and make sure you guys get it. It's the Vaccine Planner tool from Ariadne Labs, who are a partner and grantee of the Commonwealth Fund, where you can look at your state, you can look at your district, you can zoom in and see where the vaccine deserts are. And you can also see where potential vaccination sites are. So it will show you where you have existing healthcare services, but that are not offering vaccinations. And I've just heard some incredible stories out of Tennessee and California and a couple of other states where the state officials are downloading this information and just splitting it up and making phone calls to figure out what they can do to help support these primary care practices and offering the vaccination. So that data is updated every week. It's linked to Google. So I'll be sure to put it in the chat. I think it'll be an incredible resource for all of you and for other state policymakers that are really looking to help be able to really deliver care at the very place where folks are indicating that they would most feel comfortable doing that. So with that, I'll stop. Thank you, Carl, and thanks all of you for being here today.